On this episode of the Ask Mike Reinold Show, we talked about returning to running after ACL surgery.
The Ask Mike Reinold Show. Helping people feel better, move better, and perform better. Before we get to the podcast, I wanted to make sure you knew about my free online course on the Introduction to Performance Therapy and Training. If you want to learn how to get started optimizing and enhancing performance, this is the course for you. Head to mikereinold.com/performance to sign up today. Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. We're here at Champion PT and Performance up in Boston, answering your questions. Anything you guys want to talk about, sports PT, performance, career advice, we're here for you. Just go to mikereinold.com, click on that podcast link. Well, let's see, we have Dan Pope, Dwesh Podell, Anthony Vedetto, Dave Tilley, Lenny Macrina, and a galley of amazing students. Is that a word? I just like
galley.
A gaggle, like a group of geese.
From a ship.
Gaggle.
Yeah, I don't think that's a word, but it seemed like it was appropriate at the time, so I went with it. But Len, what do we have for students today?
We have lovely students. They've been here since last week, and they will be here for another couple more weeks. Reading questions for the audience. Reading the question today looks like he's taken the alpha position. Is Jacob Kissman, I'm assuming it's how you pronounce his name, Kissman, from the University of Nevada at Las Vegas. In the back that you were not seeing because you're not watching this episode is Hannah Vicknair from the Franciscan Missionaries of Our Lady University. Franciscan Missionaries of Our Lady University, yes.
There's a nickname, right? Did we just call that
Fran U?
Okay,
Fran U. And another name that I'm not going to say. Okay, we also have Gavin Harden from the University of Wisconsin, and we have Ben Fugitt, Fugitt, you pronounce it how you want to, Fugitt from Creighton University. Done.
Do we need to outsource this to like Anthony or something? I feel like it's like.
How do you say your name, Ben, again? Fugitt.
All right, we can move on. What do we got, Jacob? What do we got for a question today? Let's get this rolling on. We're gonna have a great episode. It's gonna be great.
We got Ellie from Texas asking, I'm trying to specialize in working with soccer players coming back from ACL surgery. Can you tell me about your return to running progressions after ACL? When do you typically start, and how do you progress your athletes?
Jacob, amazing job. Best question we've had today, read from a student. So congratulations on that.
Great radio voice too.
That was really good. I like that. Very fitting. I like that. All right. So this is a good question. What I liked about this question. So, I like how she wants to specialize in a sport. So she wants to like nail this down. Recently at Champion, we've kind of said like as a group, like, let's review some of our systems and process that we have for some of these things. So, Ellie, I think, we're always, revising what we're doing too, like what's best practices for these sorts of things, like how can we kind of integrate that. So I like how you have this here. I feel like if I were to Google every ACL protocol from different places around the country, when and how to start running programs varies a lot. And we see that with like lots of different protocols, right? But for me, I think this is one of those ones that, to me, it usually comes down to like, it's just that running programs are so variable. So if you don't put a lot of emphasis on a slow ramp up of a running program, right, you're probably delaying a little bit and then ramping up really fast, right? Our approach, we like to kind of like script this out for months to have like a slow application of load. So I'll let the team kind of like, kind of dig in a little bit deeper. But why don't we start with this? I think to fully answer her question, Len, let's start with you here. She didn't specifically ask this, but what is your criteria to say this person is ready to start a plyo and running progression? What tests do you do? What do you look for? More importantly, when aren't they? Maybe ready to do it, because it's not about time, especially after ACL, especially when this is like a several month process. Like you can wiggle back and forth based on that. But Len, what's your criteria?
Yeah, it's complicated. It's, but obviously
it is.
Obviously a quiet knee. So first off, do they have good motion? Full like basics, right? Don't just jump into what's their peak quad torque at 60 degrees per second. You know what I mean? Like let's go simple. Do they have full knee extension range of motion? Do they have
just to clarify though, you do strength test, right? And that
we
is
do, but
important.
yeah, we have
okay,
to.
good. Just checking.
There's a whole series that leads to are they ready for strength testing? Do they have full knee extension range of motion, flex range of motion, a quiet knee, good patella mobility, no anterior knee pain? Have they gone through a good strength and conditioning program that's loading their knee and they're not compensating using a hip strategy? So we're always trying to monitor that and push that. If so, at around 3 months, you can test early. I know some universities and other practices test early. I wait until about 3 months. I typically see patella tendon grafts, just so everybody knows. And I'm looking at their peak quad torque using an isometric contraction at 90 degrees of flexion. It's just easier for me to set up at 90 degrees of flexion than at 60 degrees. And so I'm looking at bilateral strength testing of quads and hamstrings. I'm looking at ratios. I'm looking at peak torque to body weight and seeing what they're at a baseline at 3 months. And then every 4 to 6 weeks after that, I'm testing with the goal of getting them about 65 to 70% quad LSI to begin a running program, which in my head is usually between 4 and 5 months. Like you said earlier, I tend to wait a little closer to 5 months, but it depends on the person and their knee and their goals and all that. But if their knee is quiet and they're doing well, then we start testing and I start doing, I'm anticipating the running program. So I'm already starting to do plyometrics. I'm starting to do pogos. I'm starting to do things of that nature to test the knee out to make sure it can handle that, that constant jarring that's going to occur with the running program. So, yeah.
Yeah. I think biggest take home from what Lenny just said that most people, especially early career professionals, don't get here. What he kind of said was it's not just quantitative, it's also qualitative that he looks at. And that's actually a big deal, right? So you can have somebody with a really ugly knee pass a strength test sometimes, right? And sometimes, especially if it's just LSI, it's just because both legs suck, right? So it'd be interesting to see that quote transcribed on the website there. I shouldn't have said it that way, but you know what I mean? It's like, that's very, very, I don't think we talk about the qualitative stuff as much. And that was the first thing Lenny said, guys. He was like, I want to look at it and I want to feel good that the quality of the knee and stuff is there. That was a good answer to that. So keep that in mind. And then I think the next thing, and this, I think we lead into Dan here, is that, at Champion, like, yes, we run, but there's a lot of things you can do prior to running, just like throwing, right? We do plyos and stuff before we do throwing. I think it's the same thing about just like increasing load. But Dan, why don't you walk through? I mean, we've been talking about this a little bit in the clinic more about kind of like systemizing this better, but what are your thoughts on like progressing somebody? So Lenny's, they've cleared Lenny like to the things he just said. And now you're like, all right, I want to start a progression to prepare them to run. Where do you go with that?
Yeah, for sure. It's pretty timely. I feel like we're always trying to change our programs at Champion, optimize and make them better. And we're doing that currently, right? So that's kind of fun. Unfortunately, Kevin's not here today. We've been brainstorming a little bit together. I think running is interesting because you can jog, you can sprint, and then there's acceleration, there's curvilinear running, and there's agility. There's a million different pieces, right? We'll just keep it simple. I'm going to start talking about just regular straight plane running and some sprinting stuff. And then maybe Dave or Vedetto can kind of pick up with the change of direction stuff so I don't talk too much, right? But what's interesting is that we can start with very low level plyometrics that are less stress than a slower jog, right? And usually that means a double legged exercise like a pogo jump. When you're running, it's one leg at a time. Pogo jumps, we need 2 legs. And I think a couple keys early on is that we're not really working on power. We use the words plyos, and plyos typically mean you're kind of moving really quickly. I think a lot of this is first establishing a little confidence with the athlete. It may have been like 6 months since they left the earth, right? If you think about that, they're a little bit freaked out when they start jumping. So sometimes we'll even do an assisted pogo. We'll have a band go over top of a rack, hold down, get some tension so it assists them with their jumping. And over the course of time, we wean them out of the band and just do more and more repetitions with the goal of building a little bit of capacity. Let's say you do around 2 weeks worth of different pogo jump variations, and then we'll start a return to run program. And when we say return to run, it's a jog. It's pretty slow, right? And I tell people to kind of select the pace you would use for a long, slow run, and it's a walk and jog protocol. And let's say it's 30 seconds of a jog, 30 seconds of a walk, 15 minutes. And over the course of, let's say, 2 to 4 weeks, you start to do less and less walk, more and more run, right? And let's say that lasts for around 4 weeks. During this time period, we're also advancing plyos a little bit too. So it's not like we stop plyos after that initial phase. And then we start doing some faster running. And we tend to break it down into two different types of runs. So you have acceleration and you have top end sprinting. And usually introduce these via fall runs. So basically stand up nice and tall, leaning forward until you're about to fall, and then you accelerate. And let's say you do 10, 15 meters, not very far. And we usually start with a percentage based strategy. Whatever the athlete perceives is the 50% of the max, we'll say, right? We had talked about this before. Should we use like miles per hour? Should we use a treadmill? One of the problems, and I see this a lot with lifters too, is that after you have a major injury, you have no idea what your 1 rep max is. So it doesn't really make any sense to use percentages of what your max is. It's currently going to be very different, and it's not really safe to test that out. I'm not going to have an athlete sprint as fast as they can and then use a percentage of that. It makes no sense. So we just use a percentage of the perceived effort. Let's say we start with around 50%. They work our way up over the course of time. We do the same thing with a build-up run. So you can do this outside or on some sort of treadmill that's self-propelled. So I usually give people 5 seconds or so to build up to a percentage of their max. Let's say we're starting with 50 or 60%. Hold that for around 10 seconds and then break down a little bit. And then what you'll see over the course of, let's say, around 2 months or so, you start with a lower percentage of the max, lower volume. You start to slowly increase the intensity, slowly increase the volume a little bit over the course of time. The plyometrics should be going up over the course of time with the run progression, with the thought being, as the volume of sprints increases, the volume of plyometrics actually goes down a little bit. And eventually, as we incorporate more agility, more sport-specific activity, we actually do less and less sprinting and acceleration work. And hopefully, by the end of all this, we're just doing, gameplay situation drills and so on and so forth. So, I think I said enough. I'll let someone else talk.
I don't know if you're on the subway, if you're driving in traffic right now. I feel like we need to all stand up and applaud, right? That was like, I feel like we've been in the middle of like many episodes where I'm like, this is a bad episode, but like right now I'm like, this is a good episode, right? This is this is pretty sweet. Dan, that was amazing, and I think like there's a few nuggets in that. So I want you to go back and re-listen to that there. And once you hear it once, I want you to then go back and listen to it again and kind of like take notes a little bit because that was very regimented what Dan just did there. And he had very sequential with what he wanted to do with people. That was perfect. So I love that. And, to Dan's point too, the only thing I would emphasize, like when we started looking at this, it's kind of funny. Like if you look at like plyometrics, to Dan's point, like plyometrics is a way too broad of a term. You could argue we're not really doing plyometrics with some of the drills we're doing, but there's some plyometrics where ground reaction forces are less than running and some that there's more than running. So you have to know that. You have to understand that. You have to put that together. That's important. All right, well, let's end at this. Anthony, you want to jump in on a little like, that was straight line running, stuff like that. How about, some agility or just multi-directional, like cutting type stuff? When do you tend to introduce that? How do you like to do that? Any tips for the audience?
Yeah, I'd say you definitely want to see a solid completion of this return to running program that Dan was just talking about first, right? So we want to see them be able to handle the capacity of running itself. So do 4 to 6 weeks of a run walk progression once we feel like they have completed that and they can run for 30, 40 minutes at a time, then I feel like they have a good capacity to then start kind of straight line running from that point. Once we see, we work on, full straight line sprinting, then it's like, okay, can we work on change of direction stuff so that, we can start utilizing some cutting and, single leg type plyometric movements so that when we can get back to kind of like field work that can really work on sport specific stuff from there. I feel like for us as PTs, once we get them past the straight line sprinting stuff, that's where kind of Dewey and some of the strength and conditioning coaches come in and they can really work on that agility type stuff. So maybe Dewey has some good points that they can that he can touch on that for sure.
Yeah, Dewey, you want to jump in and talk about like, because that's actually a good point that Anthony makes. Like it's very hard to do this all in a PT session, right? Like we're fortunate that we get to collaborate with some strength coaches. If you don't have that at your facility, I do urge you to find somebody nearby you can do this. But Dewey, any thoughts from you on this? And then also like, to Anthony's point, I think sometimes we rush into like starting to get into agilities, right? Like if you can't accelerate and decelerate and brake, like why are you doing a cutting
drill. You know what I mean? Like that's not like you're not ready for that. But Dewey, what are your thoughts on that? Those late stage progressions from the strength and conditioning side from that, and what would you do different?
Yeah, definitely want to re-emphasize to Anthony's point. Like, yeah, let's definitely take care of the straight line stuff first from a confidence perspective and a comfort perspective. Maybe even like start to see some pretty good outputs, as in like speed and stuff like that. And then as far as the agility stuff goes, I start with a lot of the basics. When I say agility work versus agility drills, like I bucket those as two different things in my head. An agility drill is not an actual agility exercise that's trying to expose yourself to high speeds or high amounts of forces. It's teaching body control and body awareness and start getting used to joint angles that you might see in cutting. And even then I kind of bucketed into like my different movement skills that are involved in change of direction. So we have our different angled cuts. We have our 45-degree cuts, 90-degree cuts, full 180 turns, right? We have our shuffling type skills. We have our crossover type skills. And we got to kind of build all these kind of starting at the baseline, right? So I might early on just work on some like shuffling and body control type stuff. Like, we call it like a little like low box change direction drill where we're literally switching feet from one side to the other, getting used to that change in center of mass from one stance leg to a different stance leg, right? We might do like a crossover to base where you're crossing over at the hip, dissociating torso and hip and sticking your landing. And we might do some singles and doubles and maybe work into some triples, meaning you're going to go crossover, crossover, crossover in the same direction, right? You might do some band assist or band resisted stuff. So now you're starting to accelerate like the decel forces that are required. So if you have a band that's pulling you into a crossover to base type position, now it's making that speed faster because the band is accelerating that. And you got to work on just decelerating that and hitting the brakes. So I haven't even done any like actual running type agility stuff yet, right? I'm just working on the baseline ability to control the forces and get my joint angles like ready to handle a lot of the stressors. And then from there, I might start actually getting into, all right, I'm going to start in a straight line and I'm going to get into a 45-degree cut and make it a box drill where it's not a reactionary drill yet. I want you to just get comfortable, right? I think a lot of people tend to jump in and say, oh, box drills are useless because that's not what you do in sport. But let's start with the easy stuff, give them a ton of opportunity to have success. And then let's introduce a little bit of reaction, right? And then let's introduce a little bit more of like a gameplay type situation where we have reaction, maybe a little bit of contact, maybe reaction to multiple layers of defense, if you want to call it that, right? Like I'm doing that with some of our ACL people right now. But yeah, I like to have a very layered approach. Honestly, it's pretty similar to what Pope just kind of laid out for the straight line running program. Like have a very layered, start with drills that don't involve speed, don't involve a ton of forces, get comfort, and then slowly start adding in the speed, start adding in the high forces, start adding in complexity, start adding in reaction. So that's where I would start.
Yeah, and that to me, Ellie, this is a beginning, right? So obviously that was a lot. I think things that you can take from this is that the sequential layer that like Dewey just like kind of alluded to from Dan there is like how you got to build that, and then just realize that like, man, there's a few buckets here, right? This isn't just like return to running program, right? There's agility change, direction change, speed, like all these types of things. I would say for you, Ellie, just like personal advice for you as you're going through this and you're starting to specialize, like you said, is like tackle each one of those buckets like individually and like dig in deep on the research, look at it, kind of outline how you would put that bucket and make those buckets like, how you'd put together, and then see where they fit, where they cross over, where can they start interacting. Because this is like a master class, right? Like all in that we're, try to cover in one episode. I mean, that's challenging. But I think that'd be, a super important way for you to kind of, hit that, Ellie. Okay. All right. So great question. Great answers. I think this was an amazing episode. So good job, everybody. That was awesome. If you have more questions like Ellie, just ask away. We'll do our best to answer as much as we can. Head to mikereinold.com, click on that podcast link, and be sure to subscribe so that way you get notifications when we have a new episode. Thank you.